Having a fall or being injured from a fall can severely impact one's quality of life and well-being. The risk of older people falling in residential aged care is particularly concerning, with 1 in 2 people falling each year. Although exercise, reviewing medications, and staff training are all helpful, recent evidence suggests that vitamin D supplements are the most effective strategy in helping to prevent falls.
Vitamin D supplement use is the most effective single intervention for prevention of falls in older people living in residential aged care. This is a contrast to older people living in the community, where exercise is almost certainly the most effective falls intervention.
Public health messages usually focus on ensuring adequate sunlight exposure as our main source of vitamin D. However, for those living in aged care homes, vitamin D supplements should be considered.
Vitamin D deficiency is a major issue. People living in those homes don't get out in the sun very much, and that's the main way our bodies make vitamin D, through formation of this vitamin in the skin. For anyone, it's hard to get enough vitamin D from dietary sources, so this is not a solution. Older people have changes in their skin, and so they don't produce vitamin D as efficiently as younger people. We know that vitamin D has the potential to prevent falls because our muscles have vitamin D receptors in them. Vitamin D also helps with calcium absorption, and so that makes for stronger bones. There are no known adverse effects of taking vitamin D supplements in reasonably recommended doses.
I originally thought about it when I had a bad fall in Tokyo, and I broke my back in a few places, and my hip in 2 places, and my cheek in 3 places, and my arm. I was a right mess. And when we came home, it took me a long time to recover. And as part of my recovery, we started to think, well, look, let's take vitamin D to start helping me strengthen my bones, in addition to addressing osteoporosis. Since starting taking vitamin D, I haven't had any other serious falls. So it's been really beneficial in that way. So I've had no serious falls, and I feel certainly healthy. And of course, it's harmless, it's relatively inexpensive, it's easy.
It's recommended in best practice guidelines for falls prevention in older people living in residential aged care that there's consideration given for vitamin D supplements use. People at risk of vitamin D deficiency, such as older people living in aged care homes, don't need to have a blood test before starting vitamin D supplements, because we know from many research studies that almost all people are vitamin D deficient. There are multiple formulations of vitamin D available, and they can be provided as drops for people with swallowing problems. We really encourage older people and their families to raise this issue with their general practitioner.
Even if I'm out walking and I stumble a little, I feel a lot stronger and less worried about falling. So I think there is a lot of benefit.